First, I'm gonna knock on the patient's door. Hi, my name is William. I'll be your student nurse today. I'm gonna check the medical records. The provider ordered an insertion of an indwelling catheter. I'll be inserting an indwelling catheter into you for your urinary retention. Can I get your name and date of birth? Look at the client's wristband, make sure it matches up. I'll provide privacy, raise the bed to working height, and do hand hygiene. Then I'll get any nursing personnel for assistance if I need it. I'll place a waterproof pad on the bed. Make sure only the genital areas covered or exposed. And I'll help them into a dorsal recumbent position with their legs relaxed. And before I put on gloves, I need to put down my side rail. Then I'll wash the client's perineal area with soap and water. First, swiping the right side, getting a new piece of cloth, swiping the left side, and then another piece of cloth, and swiping down the middle. Then I'll pat the area dry. Remove my gloves. And perform hand hygiene again. I'll get my container, my stuff in it, my supplies, put the bag as a trash bag. Open away from me, to the sides, and to me. Then I'll put on my sterile gloves. Grab the sterile drape and let it open by itself. And place it in between the client's thighs. I'll grab the other drape, letting it open without touching anything sterile. I'll place that the perineal area. Then I'll open up my swabs, already I've opened. Then my lubricant, I'll put in the lubricant department. Then I'll put this off to the side. Then I grab my specimen cup. The lid should be loose. I can put that to the side. Then I'll unsheath the catheter. Slowly making sure it doesn't touch any sterile field. Then I'll lubricate the catheter. I can put that back. And then I'll attach the syringe to the port. Then I can put my lid back on. Bring my box to the sterile field. Place that down. Then with my non-dominant hand, open up the labia, and I'll clean with a swab first on the right side. Next on the left side. And then lastly down the middle. Next, I'll grab the catheter, 2 to 3 inches, and ask the client to bear down and insert the catheter slowly. Then I'll put it in 2 to 3 inches or until I see urine, and then another 1 to 2 inches. Then I can grab the catheter with my non-dominant hand and slowly inflate the balloon. Throw that away and make sure it's snug. And then I can take my gloves off. Then perform hand hygiene. Apply clean gloves. Hands are so sticky. Holy. And then should be able to move, tear off the straight. And secure the catheter to the leg. The inner thigh on a female. grab the drainage bag, and you come over here. Attach it to the side of the bed and not the side rails. I should be able to remove all this. Then I'll grab my specimen cup and collect specimen from the drainage bag. (20 to 30 milliliters of urine. And then close that off. Put the lid back on the specimen bottle. And wipe down the port with an alcohol wipe. And put the port back in. I can dispose of all this stuff. And need to make sure there's no leakage from the tubing or the catheter. Then need to wash the perineal area after getting urine and dry it off as well. Then I can assist the patient to a comfortable position, taking off their drape. And I lower the bed rail, or lower the bed and raise my bed rail. I take off my gloves and perform hand hygiene again. And I missed it, but before I take off my gloves and lower the bed, I'd palpate the bladder and ask the patient if they have any pain. Lower this all the way till it goes all the way down to the bottom. I'm just gonna leave it there, but if you pretend it went all the way down the bottom, so it'll be here for a while. And then I need to document my the catheter I use. I use a 14 French catheter. It was for an indwelling catheter as well. It's for urinary retention. And I used 10 milliliters of sterile water. And I got a 20 milliliter urine sample, and it was clear and odorless. The patient took the procedure well, and then document the input and output. And I'd come back in an hour, and if the patient had no urine in the drainage bag, I would report it to the provider and make sure their call light is within reach. And that's my video.